34-year-old Jaimie Schneider has energy she hasn't felt in a long time. 4 years ago, she was diagnosed with kidney disease.
I was going to the doctor because I was having headaches and facial pain, and I thought it was sinuses, and they told me that I had high blood pressure.
That led to further testing. The prognosis, she would eventually need a kidney transplant.
When I walked out, I fell apart and called my family, and my dad said, "We'll make it through anything." So we went from there.
The Washington, Missouri mom talked with her doctors at Barnes Jewish Hospital and Washington University School of Medicine. The more she looked into the issue of live kidney donation, she found sources of information all around her, including through her job as a hairstylist. One of her clients, Amy Waterman, is a transplant psychologist and researcher, and other clients were either recipients or donors.
Every client that I talked to knew someone that had a transplant, and I love to hear those stories.
Doctors told her best chance for a new kidney and a new life was a live donor, which experts say is often the case.
The need for living donors is critical. It's very well known that living donor kidneys have the longest long-term graft survival.
When the moment came for Jaimie, 5 family members stepped forward to offer a kidney, including her husband Scott and her brother Steve.
It wasn't shock because we knew this time was going to come. We didn't know when. But yeah, I was probably scared more than anything. Maybe, a little nervous, not knowing what was going to happen, how it was going to work.
3 of her 5 potential donors were a match, and her brother helped make the final decision.
He just told us that he wanted to be the one that wanted to do it.
So after a few months of tests and preparation and a quick pre-surgery prayer, both brother and sister went into the operating room.
At Barnes Jewish, we perform 2 forms of minimally invasive kidney donation surgeries. We perform laparoscopic kidney donation, and we also perform the mini nephrectomy operation.
With both procedures, the patients have short hospital stays, usually 2 to 3 days for the donor and 3 to 4 days for the recipient. Jaimie says her recovery went well.
Mine was amazing. felt fine, little to no pain. I took over-the-counter Tylenol for pain medicine, so I felt great.
She says the anti-rejection drugs took some time to get used to, and her brother had some pain for about 2 weeks. But it wasn't long post-transplant. She was feeling stronger than ever. She's back to work and home enjoying her family. Jaimie's family noticed changes in her immediately.
He stays up later, because usually when she didn't have a new kidney, she usually went right to sleep.
She was tired a lot. And now?
She stays up a little bit longer.
I have more energy, that's great. I think when anyone's sick and knowingly sick, they have less patience, and I have more patience with my kids and my family.
Doctors at Barnes Jewish Hospital performed almost 200 kidney transplants in 2009, and about 35 to 40% involved living donors. While Jaimie says she already had a very close relationship with her brother, the gift he gave her cemented it for life.
It's very special. I think we would do it for each other, and I think he is a hero. I don't think he looks at it that way, but I do.
He's, I guess you'd say, a shy person, but he did a very a noble thing.
Doctors point out there has been extensive research showing that living donors have no higher risk throughout their life of developing renal failure and no higher risk of mortality.